Everyone. This is the lecture for Module 2 of PrePracticum. Module 2 is all about client records and informed consent. So this PowerPoint will be linked into your Blackboard, so you will have access to it. I'll link it as a Google Doc or Google Drive, Google PowerPoint. So you can click on all of the links that are inside the PowerPoint itself, because it's going to give you a lot of places to go for reference. So today we're really going to be talking about three different things. We're going to be talking about privacy, we're going to be talking about record keeping, and we're going to be talking about informed consent. So the way that I broke this up is to look at the ACA Code of Ethics from 2014. That's the most current Code of Ethics. ACA is working on a new Code of Ethics. The world has changed a lot since 2014, but this is what we're going to reference today. So linked into here is the ACA Code of Ethics. So I'm just going to click on it and it'll bring it right up for you. You can also Google it. It is a free document for you. And when we look at privacy, we're going to start on page 4, and we're going to talk a little bit about client records. So if you look at page 4 here, you can look at under client welfare. The primary responsibility of you as a licensed mental health counselor is to respect the dignity and promote the welfare of your clients. So under A.1.B, it talks about records and documentations. So counselors create, safeguard, and maintain documentation necessary for rendering professional services. Regardless of the medium, counselors include sufficient and timely documentation to facilitate the delivery and continuity of services. So if you work in an agency, documentation is part of your job as an LMHC. Documentation sometimes can be the hardest thing for counselors. For me, it's very hard because as a school counselor, I don't know about you guys, but I keep everything in my head typically, or I kept everything in my head. So to shift to writing down client records with treatment plans and the assessment of the client in the moment and goals sometimes can feel like a shift, but we're going to teach you how to do that, and you'll get to practice it. Counselors take reasonable steps to ensure that documentation accurately reflects client progress and services provided. If amendments are made to records and documentations, counselors take steps to properly note the amendments according to agency or institutional policy. So what this means is, depending on where you are employed, right? If you're employed in an agency, if you're employed in a hospital, if you're employed in a private practice, if you have your own private practice eventually, your record keeping is going to look different depending on the institution that you are employed by. It's also going to look different, and we're going to look at this depending on the insurance company. So each insurance company that you work with will have different protocols and processes for record keeping that you have to follow, and insurance companies will come in and audit you to make sure that you are following those processes. So that's what we have about client records, and we're going to talk a lot about client records right now. So I'm going to go back to the module. So let's start with HIPAA, HIPAA. So HIPAA is the Health Insurance Portability and Accountability Act of 1996. So what did HIPAA do? So HIPAA is a federal law that required the creation of national standards to protect sensitive patient health information from being disclosed without the patient's consent and knowledge. The U.S. Department of Health and Human Services issued the HIPAA privacy rule to implement the requirements of HIPAA. The HIPAA security rule protects a subset of information provided by the privacy rule. So I want to talk to you a little bit about the privacy rule. So the HIPAA privacy rule standards address the use and disclosure of individuals' health information known as protected health information, or PHI. So PHI is an acronym that you're going to see a lot as an LMHC. It stands for protected health information. These individuals and organizations are called covered entities. The privacy rule also contains standards for individual rights to understand and control how their health information is used. A major goal of the privacy rule is to make sure that individuals' health information is properly protected while allowing the flow of health information needed to provide and promote high-quality health care and to protect the public's health and well-being. The privacy rule permits important uses of information while protecting the privacy of people who seek care and healing. Okay. So as an LMHC, you're covered under a healthcare provider. You are a covered entity. That means that the HIPAA rule applies to your clients, and that you need to have releases of information in order to share any of your clients' protected information with another entity. So when you go into the field, right, if you're working for an agency or under some sort of institution, they're going to have processes in place for this. There's probably some sort of HIPAA release in, intake paperwork. If you're going to work in private practice, you want to make sure that you create a HIPAA consent for your clients to sign. We want to make sure that we're never talking to anybody other than the client about the client's information. So there are a lot of links that can help you to figure out where this is, and they're all linked into here. So what is required under HIPAA? This brings you to the U.S. Department of Health and Human Services website, and this goes right into the mental health field. So any questions that you have about HIPAA, you always want to contact an expert in the situation. You can contact ACA, you can go to this U.S. Department of Health and Human Services. There should be somebody, legally that you're able to contact as well. So all of this specifies all of these like frequently asked questions about mental health. So may specialists provide therapy to patients in a group setting? So disclosures of protected health information in group therapy setting are treatment disclosures and thus may be made without an individual's authorization. So as an LMHC, these things are going to come up for you, and you're going to be able to go to this site and figure out answers to these questions. You also have an assignment using this website, because I want you to be familiar with it. So that the assignment will help you to be a little bit familiar with it as well. And so this is the FAQs for mental health professionals. Here's a good one, because we work with kids. Does HIPAA allow a provider to disclose PHI about a troubled teen to the parent? Protected health information is PHI. And so the answer is here. Where the HIPAA privacy rule applies, does it allow a healthcare provider to disclose protected information about a troubled teen to the parent of the teen? And here's what it says. In most cases, yes. If the teen is a minor, the HIPAA privacy rule generally allows a covered entity to disclose personal health information about the child to the child's parent as a minor child's personal representative when the disclosure is not inconsistent with state or other law. Here's the big part of this, okay? So the U.S. Department of Health and Services gives these like federal overview guidelines, but depending on the state that you work in, the guidelines might be a little bit different. And we're going to look at New York State's guidelines. So if you're working in New York State, we'll cover that. If you're working outside of New York State, it's going to be really important for you to look at the guidelines of that state in comparison with the HIPAA privacy rule from the U.S. Department of Health and Human Services. So I found this infographic. This comes from the CDC, and I thought that this was really interesting. As folks that have worked in school districts, right, you should be familiar with FERPA, the Family Educational Rights and Privacy Act. And this is a chart that tells the difference between FERPA and HIPAA. It's really helpful because sometimes things can get confusing. It can also get confusing if you've been a school counselor, school psych, or social worker for so long, and then all of a sudden you have to learn about the HIPAA rules as an LMHC, right? So inside your school building, you're still going to abide by FERPA, and then in your practice, you're going to abide by HIPAA. So it might get a little bit confusing. So who must comply with FERPA? Any public or private school, any state or local agency. Who must comply with HIPAA? Every healthcare provider who electronically transmits health information in connection with certain transactions. That's you. So you have to definitely comply with HIPAA. Business associates that act on behalf of a covered entity, including claims processing, data analysis, utilization review, and billing. We're going to show you some pretty popular like electronic health record sites in this lecture. And when you get into your practice, different folks have different ways of doing billing. Agencies usually have a billing department, so they're protected by, clients are protected by HIPAA there. If you're in private practice, you're going to either do the billing yourself, or you're going to have some sort of third-party billing department help you, and they also have to abide by HIPAA. Protected information under FERPA are student education records. You guys know this, all the records in there, in your school. And then under HIPAA, protected health information. So individually identifiable health information that is transmitted or maintained in any form or medium. So it's not just electric, it's anything that or electronic, anything you're writing down, anything that you're speaking. If you're picking up the phone and you're calling your client's, PCP or pediatrician, all of that information is protected by HIPAA. And then permitted disclosures. So who can disclose under FERPA? School officials, schools to which a student is transferring, right? You get the little paper that's signed off on, and you send their records, all of those kinds of things. So HIPAA, who has permitted disclosures to the individual? Obviously, you can speak to the individual about their own health, their health information. Treatment, payment, and healthcare operations. So that again is that falls like under billing or any sort of adjacent treatment that you're doing with another provider, so a PCP or a pediatrician, but of course you want to get a release to speak to those people. Uses and disclosures with opportunity to agree or object by asking the individual or giving opportunity to agree or object. So that is your HIPAA release again. Incident to an otherwise permitted use and disclosure, public interest and benefit activities, and then limited data set for the purposes of research, public health, or healthcare operations. Again, you're going to get consent to do all of those things. So this comes from the CDC. It's a really great infographic. I would say print it out. This would be helpful in your role as an LMHC and in your role in the school as well. So we talked about New York State a minute ago. So understanding again that HIPAA is the federal guideline, but you have to look at the state within which you're practicing to look at specific things that are protected under HIPAA. And you always want to ask the experts. So you always want to go to your LMHC governing body. You want to go to your legal department if you have that, if you're in an agency. You want to get supervision, right? You want to make sure that you ask the experts about this kind of stuff because it is out of your scope of practice. So if you click on this, this will bring you to this great pamphlet, and this is put out by New York State, the New York State Civil Liberties Union, and it's pretty up to date. So this is the minors' rights to confidential health care in New York. So if you're working with a child under the age of 18 as an LMHC, this is what you need to know. When a young person seeks health care, ideally a parent or guardian is involved, but we know that that's not always the case. In some cases, communication with parents or guardians about needing certain kinds of health care is difficult, and involving a parent can even be dangerous. In extreme cases, young people have been mistreated or forced to leave their homes when a parent discovers that a child is sexually active. Fear of the consequences from disclosure prevents some young people from seeking necessary treatments or preventative care, leading to serious health consequences. So as an LMHC, we don't ever want to be the barrier to kids not getting the support that they need. Interesting fact, some agencies have different policies around parental consent when it comes to working with kids. So I'm in Rochester, obviously, and we work very closely with an agency called Delphi Rise, which is a substance use and prevention agency out of Rochester, co-located in a lot of school buildings. Maybe some of you are familiar with them, maybe they're not. Their funding, I believe, comes under OASIS. Therefore, they follow those rules, and those rules say that they do not need consent to provide those services to a kid, right? They're protected under their agency. Unless you are protected under an agency, then you do need consent, to provide services to kids. In New York State, kids age 12 and older have to give you consent to share their treatment records with their parents. So let me say that again. In New York State, kids 12 or older have to give you consent to be able to share their treatment records with their parents. So you need to have, if you're in private practice, you need to have, and you're working with kids, you need to have some sort of release that says that the parent can look at the kids' treatment records. equally as important, if you're working with teens and they transition from being 17 to 18 years old, the minute they're 18 years old, the parents don't have any rights to their records anymore. So just making sure that you understand those transitions. Of course, there are limits to that, as all limits to confidentiality, right? So if somebody's going to harm themselves, harm someone else, or somebody's harming them, then you can breach those limits of confidentiality. Other than that, they have to sign off on that. A minor is a person 17 and younger, like I just said. So when somebody turns 18, the rules change. So understanding what that looks like. Informed consent. We're going to talk a lot about informed consent this week, and you guys are going to make your own informed consent. And then confidentiality. So information about a patient's testing, diagnosis, and treatment cannot be disclosed without the patient's permission. Confidential healthcare for adolescents means that when an adolescent patient has the legal ability and capacity to provide healthcare, age 12 in New York State, a provider may record or medical information to anyone, including parents, school personnel, or law enforcement, without the adolescent's patient consent, unless otherwise specified by law. Again, someone's hurting them, they're hurting someone else, they're going to hurt themselves. So 12 years old is kind of that magic number. Certain minors can consent to any type of healthcare on their own. So if you're working with an emancipated minors, if they're living on their own, they're financially independent from their parents. If they're married and they're a minor, if they have children, consent to their own healthcare and the healthcare of their children, and incarcerated minors. So if you're working with any of those populations, you do not need parent consent. A lot of the stuff is about medicine. So mental health care. Minors can consent to outpatient mental health counseling in a facility licensed by the Office of Mental Health. Under certain circumstances, minors can consent on their own to inpatient treatment. For more information about providing minors with mental health care or substance treatment, consult with a supervisor or seek legal advice. So you want to make sure to do that, because it can look different based on the entity that you work for, based on the state that you work in, all of those types of things. So this is linked right into here. And like I said, it's pretty updated, so it's a good reference to have. All right, so we are going to change topics real quick to record keeping. So we're going to go back to the ACA Code of Ethics, and we're going to see what it says about record keeping. So if we go down to page 7, we're looking at B6. And it's right here, records and documentation, creating and maintaining records and documentation. So counselors create and maintain records and documentation necessary for rendering professional services. So again, it is within your scope of practice. Ethically, you have to keep records on your clients that you're seeing. Confidentiality of records and documentation. Counselors ensure that records and documentations kept in any medium are secure and that only authorized persons have access to them. So it depends on how you're keeping your records. If you're doing an electronic healthcare record, there's lots of sites and things that you can use that are HIPAA compliant. If you are keeping records in your office, if you're more of a handwritten record person, make sure that they are in a locked storage container, like a locked shelf or a locked some sort of locked storage container, and then make sure that your office door is locked as well. So you want the double locks on there so nobody can get into those records. Permission to record. Counselors obtain permission from clients prior to recording sessions through electronic and other means. You cannot record your client without permission. So you need to make sure that you get permission to record if you need to do that. Permission to observe. Counselors obtain permission from clients prior to allowing any person to observe counseling sessions, review session transcripts, or view recordings of sessions with supervisors, faculty, peers, or others within the training environment. So this is really going to apply to you when you get into your internship and also when you're under your limited permit. So you need to make sure that your clients know that somebody else is going to be listening to recordings of them, or if you're working under your limited permit, that your supervisor will have access to their records as well. Client access. Counselors provide reasonable access to records and copies of records when requested by competent clients. So this can go into your informed consent as well, the process for how to get access to your client's records. So you want to be really careful of what you write down, right? This is not going to be much different from the school setting when you're very careful of the things that you write down in your client's records. You want to be respectful, right? You don't want any sort of bias to come through in the records. You want to make sure that you're given a diagnosis, a treatment, you're following goals, any sort of assessment that you need to do is in there. But just remember, anything that you're writing, somebody else might have access to and see. When clients request access to their records, counselors provide assistance and consultation in interpreting the records. So I've had clients in the past say, oh, I want to see, I want to read my records. So I've sat there with the client and helped them to understand what the records are saying. Disclosure or transfer, unless exceptions to confidentiality exist. So that's when something needs to be signed. Counselors obtain written permission from clients to disclose or transfer records to legitimate third parties. Steps are taken to ensure that receivers of counseling records are sensitive to their confidential nature. So again, if you're going to share records with a PCP or a pediatrician, you need consent to be able to do that. And you want to make sure that your writing in there, that your writing reflects you as a professional, as a counselor. Storage and disposal after termination. Counselors store records following termination of services to ensure reasonable future access, maintain records in accordance with federal and state laws and statutes such as licensure laws and policies governing records, and dispose of client records and other sensitive materials in a manner that protects client confidentiality. So even when your client terminates with you, you are not throwing away their records. And we're going to talk about how long you have to keep them. When you do throw away the records, you're making sure that you are shredding them and that they are not able to be seen by somebody else, right? We want to make sure that the disposal after termination follows the guidelines in the ACA Code of Ethics. And then reasonable precautions. So counselors take reasonable precautions to protect client confidentiality in the event of the counselor's termination of practice, incapacity, or death, and appoint a records custodian when identified as appropriate. So if you work in an agency, you're going to have a supervisor, you're going to have somebody that sees your records. When you are under your limited permit, you're going to have a supervisor and somebody that sees your records. When you move from your limited permit into your LMHC, you want to make sure that you have somebody designated that if God forbid something happened to you, can pick up where you left off and is able to, contact clients and that sort of thing. We had a tragedy, this was a while ago, probably 10 years ago, where a private practitioner in our community did pass away, and they didn't have anything written about what to do next. So those of us that were in the practice had to go into their notes and find, all of their clients' contact information and inform all the clients that their counselor had passed away. And then we had to figure out what to do next because the counselor hadn't written any of that down. So make sure when you transition from your limited permit to your LMHC, and if you're in private practice, you have stuff in place for that. All right, so record keeping. In New York State, you must keep records for 6 years or until the patient turns 22 years of age, whichever is longer. So if your patient is 21 years of age, you have to keep their records until they're 27 years of age, right? If your patient is 10, right, you have to keep their records until they're 16, okay? So the New York State Codes, Rules, and Regulations. Again, this is linked right into here. This is section 40413 of the New York State Rules and Regulations of Record Keeping. And this tells you exactly what you have to do. It tells you exactly what needs to be in the records. And we're going to talk about that in a second. But this is very clear. It talks about confidentiality. It talks about, what New York State regulations are. If you're going to practice in another state, I would highly suggest that you go to that state's website when you start practicing and you see what their record keeping procedures are. And then the Board of Regents, Part 29, Unprofessional Conduct. So why is the Board of Regents in here? Because LMHCs are under the New York State Office of Professions, which again is regulated by the Board of Regents. So if you look at Part 29 of Unprofessional Conduct, this tells you what you cannot do. So all of you are not going to do these things anyway, but special provisions for the professions of creative arts therapy, marriage and family therapy, mental health counseling, and psychoanalysis. So if you go up here, there's the general provisions, right? Unprofessional conduct shall be the conduct prohibited by this section. Tells you all the things that you can lose your license for. And then you go down to the mental health one, and it tells you more things that you can lose your license for. So unprofessional conduct, this one's interesting. In the case of treatment of schizophrenia, schizoaffective disorder, bipolar, major depressive, panic, OCD, attention deficit, and autism, providing any mental health service for such illness on a continuous and sustained basis without a medical evaluation of the illness by and consultation with a physician regarding such illness is unprofessional conduct. So as an LMHC, you need to be in contact with your client's PCP or your client's pediatrician all the time, right? We're not going to work in a vacuum, but especially if you're working within these disorders. Such medical evaluation and consultation shall be to determine and advise whether medical care is indicated for such illness, right? B, you cannot prescribe or administer any drugs as treatment, therapy, or professional service in the practice of your profession. It is outside your scope of practice. You can talk to PCPs and psychiatrists and pediatricians about what you are observing, what you are assessing in your client. You can consult with them. They do the prescribing, not you. Using invasive procedures as treatment, therapy, or professional services in the practice of his or her profession. For purposes of this subdivision, invasive procedure means any procedure in which human tissue is cut, altered, or otherwise infiltrated by mechanical or other means. It is not limited to surgery, lasers, ionizing radiation, therapeutic ultrasound, or electroconvulsive therapy. Outside your scope of practice. We can do a lot of alternative therapies. We can do expressive arts therapy, we can do sand tray, we can do play therapy, we can do mindfulness and meditation. We are not medical doctors. So all of those other procedures are outside your scope. So again, this is linked right into here, and it's just good to know what you can and cannot do. So here's what has to be in records at the minimum. Again, you have to keep these records for 6 years of age, or 6 years, or until the patient is 22. There's multiple ways that you can keep records. When we move into the module on the intake interview, we'll talk more about that, but you can have the client fill out records. You can, do it through an interview where you take notes on the records. You can do a combination of both, but you want to make sure that you have at least at minimum these points in your record keeping. And again, this comes right from that New York State regulations website. So patient name and contact information, reason for the initial contact, preliminary assessment, and subsequent disposition. So this is going to be your, why did the client come? What assessments did I give the client? And what do I think is going on with the client? Comprehensive assessment of the problem, including reasons to support the assessment. So this is going to be your diagnosis with the criteria from the DSM-5TR on why you believe that that is what is happening, in conjunction with any assessments that you gave. So just a little write-up about that. History of treatment for same or related condition, including any medical evaluations and prescriptions if appropriate. So again, this is going to come from that intake. So you say to your client, have you been treated with this before? How long has this been going on? Who was your therapist in the past? Who is your medical doctor? What medications are you on? And you're going to document all of that. Your plan for service is your treatment plan. Your dates of services and issues of significance discussed during each contact with the patient, including specific actions to be taken related to those if relevant. So every time your client comes in, you're going to do a little progress note. We're going to teach you how to write progress notes in this class, but you're going to have the date of your service. You're going to have the initial diagnosis. You're going to have the treatment plan. You're going to have a progress note, and then you're going to have next steps in there. Let's see, discharge summary, including specific notation of any plans for future treatment and or referral for circumstances which a patient stops using services against your advice or because you are leaving the agency or practice. So a discharge summary would be once they get to the goal that they've achieved, then you've discharged them, or something is happening with you and you need to discharge them, or the client's issue is again outside of your scope of expertise and you need to make a referral. It is okay to refer your clients for a higher level of care. not only okay, it's ethical and it's what you have to do. So that's where that would go. Specific steps taken at any time during the course of service to assess and treat issues of potential danger to the patient and or others, such as suicide or homicide, or the suspected abuse or neglect of a child. So if you're doing a suicide assessment, a lethality assessment, that has to be in here. If there is some sort of suspected abuse or neglect and you're going to call CPS, that has to be in here. A lot of agencies require a safety statement at the end of their progress note, and we'll talk about that. But that would be in there as well. And then any consultations with other professionals, including reason for the consult and outcome, and the patient's authorization to release information. So my client signed this release of information to their PCP. I spoke to the PCP on August 15th. This is why I spoke to them. This is what they said. This is what we're going to do next. And that goes into the record. So again, this is in here. It is linked to that website, but these are the things at a minimum that you should have in your records. If you're working in an agency, they're going to have probably their own record keeping on top of this. But this is just for you to know, this is what New York State requires. So an EHR, another acronym, is an electronic health record. So electronic health records, I have not used them, but I have lots of friends that are in private practice that swear by them and say that they're wonderful. There are a lot of them out there that you can use. You do have to pay for them, but it can make your life way easier, is what I've heard. So EHRs provide accurate, up-to-date, and complete information about patients at the point of care. So when you are in an agency setting, they're going to have their own electronic health records. You'll be trained on those and you'll understand how to use those. If you're going to be in private practice, down here at the bottom, I'm not endorsing these. I'm just showing you two examples, therapy notes and simple practice. I asked two of my really great colleagues what they use, and that's what they use. But there's a lot of them out there. EHRs enable quick access to patient records for more coordinated, efficient care. Securely share electronic information with patients and other clinicians, so you can send information through the electronic record. It helps providers more effectively diagnose patients, reduce medical errors, and provide safer care. There are safeguards that are put into place in like therapy notes and simple practices to help you to do that. They improve patient and provider interaction and communication, as well as healthcare convenience. So you can talk to other providers through the EHRs, which is really helpful. Enables safer, more reliable prescribing. So if you're using an electronic health record and you're able, if you have consent to send that record to the patient's or the client's PCP or pediatrician, then they can see your notes directly, and that's going to help with their prescribing for treatment. Help promote legible, complete documentation and accurate, streamlined coding and billing. It takes a lot of time to do the billing and the coding and the communicating. If you're handwriting stuff, it can be really hard. I know before electronic records made this really easy, for every client that you saw, you would have to fill out a form to the insurance company and provide so much information on that form, and it just takes forever and ever. So this can really help with that. And then we talked about privacy and security earlier about locking up your records, but an electronic health record will be password protected, and all of the patient's or client's data will be in there. So linked into here is this is therapy notes. So if you want to take a look at that, you can. And then simple practice is also in here as well. And again, you know, it costs money, but you have to decide what's going to be best for you. This is typically if you're going to be in private practice, agencies have their own EHRs for you to use. So this is an example from Excelis. This is not my sheet because I'm not paneled with Excelis. But this is actually a licensed clinical social worker that I work with very closely. So I wanted to show this to you because each insurance company has different expectations for what needs to be in the records, and they will give you what those expectations are. This one is 6 pages long. It's called the Behavioral Health Treatment Record Review Criteria and Scoring. And what happens is Excelis will come in and they will spot check your records. So insurance companies do provide audits on your records, usually every couple years, to make sure you're doing what you need to be doing. So you can see in here what item has to be in there and then how many points they get for that item. So say that the Excel person comes in, they grab one of your charts. This is the form that they're going to use to make sure that your treatment records are up to date, and that your client records are up to date. So once you get paneled with insurance, you'll get this from the insurance providers that you were working with. All right, lastly, informed consent. So we've talked about client records, we've talked about privacy. Now there has to be a way for you to share all of this information with your clients, right? So this is going to be your informed consent. Informed consent is super, super, super important. It is a document, an agreement between you and your clients. It is signed by you. It is signed by your clients. So we're going to go back to the Code of Ethics and informed consent. We're going to start on page 9. It talks about informed consent. Okay, so page 9, C4. Right here. Professional qualifications. So I put this in here because in your informed consent, and I'm going to show you an example of my informed consent, you need to let your clients know what your area of expertise is, what your credentials are, and accurately represent yourself. So under professional qualifications, counselors claim or imply only professional qualifications actually completed and correct any known misrepresentations of their qualifications by others. You truthfully represent the qualifications of your professional colleagues. You clearly distinguish between paid and volunteer work experience and accurately describe your continuing education and specialized training. So in your informed consent, as a counselor under a limited permit, you must say, I am a counselor that's working under a limited permit in New York State, and I am being supervised by whoever, Hennessy, Lustica, LMHC. Here's my contact information. Here's my supervisor's contact information. As my supervisor, Hennessy has access to all of your client records. I will also be speaking with Hennessy and discussing your case with her to make sure that I'm providing the best treatment that I can. You need to make sure legally and ethically that you tell your clients that. Credentials, counselors claim only licenses or certifications that are current and in good standing. Once you get your limited permit, you will have a license number given by the New York State Office of Professions. You will put that on there. You will also have an MPI number, and you'll put that on there as well. Educational degrees, counselors clearly differentiate between earned and honorary degrees. Implying doctoral level competence, counselors clearly state their highest earned degree in counseling or closely related field. Counselors do not imply doctoral level competence when possessing a master's degree in counseling or related field by referring to themselves as doctor in a counseling context when their doctorate is not in a counseling or related field. Counselors do not use ABD or other such terms to imply competency. So as someone with a master's degree and eventually a certificate of advanced study in mental health counseling, that's how you are called. You say that these are my degrees on there. If you have a PhD or an EDD in counselor or a related field, my PhD is in counseling, education, and supervision, then I can be referred to as doctor with my clients. And then we're going to skip down to page 11, and this tells you all about informed consent. So let's see. E3, informed consent in assessment. I'm trying to find the informed consent in general. Let's see, give me 1 second. I wrote it on the wrong page. I'm going to go back up to the table of contents. Let's try again, page 11. Okay. Informed consent and assessment. So prior to any assessments that you're doing, And yes, you can use assessments as an LMHT. You explain the nature and purpose of assessment and the specific use of results by potential recipients. The explanation will be given in terms and language that the client or other legally authorized person on behalf of the client can understand. So you want to make sure when you're giving your informed consent, when you're talking to clients, that you're not using a lot of educational jargon or, mental health illness jargon. You want to be as transparent and genuine as you can with that. So I'm going to go back. Let's see. And we are going to watch this video on the 14 things that your informed consent must have. So I'm going to play this for you right now.
You already know that informed consent is one of the most important things to review with your clients at the very start of therapy. But how much do you actually need to review? What goes in that form? Does it need to be this long form full of legalese? Hi, I'm Dr. Melissa McCaffrey, founder of the free private practice paperwork crash course, and today I'm going to share with you the 14 things you want to have in your informed consent document. Now, obviously, this is just one of the forms you need for your whole intake process, and we reviewed all of the forms you need in last week's video, so we'll link to that in a card here or down below, so go ahead and click that if you haven't watched that video yet. Number 1, limits to confidentiality. You need to outline exactly when you might need to break your client's confidentiality. Now, usually this happens when you have to make a child abuse report or when someone is suicidal and might harm themselves or even harm someone else. These are fairly general and common for all of us in the field, but there are nuances depending on your state and your profession, so you need to make sure you're very clear on what those limits are and outline them very specifically in that document and review them verbally with people to make sure that they understand it. Number 2 is the risks and benefits of therapy. Yes, there are potential risks and benefits to being in therapy, and your client may not have considered both of those things. Now, you don't have to go into a ton of detail here, but for example, one common thing that does happen is people make major life decisions or learn great things about themselves from being in therapy and then might change their mind about certain beliefs they have or actions that they're taking currently. The key here is you just want to let people know you can't promise that therapy or counseling is going to be all sunshine and rainbows and that everything in their life is going to be perfect and turn out great just because they're going to see you. It probably will, but we can't guarantee it. The third thing is your scope of practice. So are you a psychologist? Are you a licensed professional counselor? There are a million different names for all of the different fields and licenses in all the different states. So just clearly outline who you are and what board regulates you. The fourth one that you've probably heard a lot more about recently is what are your expectations for the length of treatment and the assessment period? So for example, some therapists are pretty clear that one session is kind of the assessment intake period and then they're done and they start doing therapy. Other therapists feel very strongly that they need 2, 3, maybe 4 sessions to complete an intake or a full assessment. So let clients know what that means for you and how you work, as well as are you fairly clear that you could probably work on something in 6 to 12 months? Or is it more like a 3-month time frame? Or are you thinking more like multiple years? That is going to depend on how you work and on your client's specific needs. You just want to give people some general guidelines on how long they can expect to be in therapy with you. Number 5 is what is your policy around cancellations, no-shows, and people showing up late? So you want to clearly outline if someone shows up 15 minutes late, is that the same as showing up half an hour late? If they show up 40 minutes late and you do a 45-minute session, are you going to see them for that 5 minutes or is their session already canceled? If someone cancels a session, is 24 hours notice good enough for you? And if they offer that 24 hours notice, does that mean that they're charged at all? Do they get to reschedule within that week, or have they already given up their time slot for that week and maybe nothing's available that week? These are the things you want to outline and let people know about. Also, think through what are the best methods for contacting you regarding these things. So do you prefer text, email, a voicemail? Will you accept any of those, or will you accept only one of those? You can do whatever works for you in your practice. You just need to make it very clear at the beginning. 6 is emergency contact information for a different therapist in case you are out of commission. So you may not need to write all the details about this other therapist, but letting people know that if you're out of commission, you have a plan in place. And so you've thought about who you would contact. For example, if you ended up in the ER one day and couldn't show up for sessions, who's going to call your clients and let them know that you are out of commission, and maybe try to reschedule with them or check in with them. 7 relates to what we talked about earlier, communication outside of the office. So how do you contact clients to communicate, perhaps if you are planning to be out of the office, or maybe to remind them about a vacation you have? And how do you expect them to contact you if they need to cancel a session, but also if they have an emergency, or if they have an emergent need they want to tell you about, but they don't necessarily need to cancel, or it's not urgent? And again, you can do this however you want. It could be email, it could be text, it could be phone, it could be all 3, or just one of those, or 2 of those. But choose something that you will stick to and that makes sense for you and your clients. 8 is social media. So personally, I don't believe you need to have a huge social media policy, but I do think it's important to acknowledge if you are on social media or not. And if you do have a social media presence, where that is, so where you maintain maybe an Instagram page or a Facebook page, and to acknowledge that you do not discuss clinical matters with clients publicly or privately via that method. The key here is really making sure that people understand if they leave a comment on a post that you are not going to reply, because you don't want to make it obvious that they're your client. And you want to recommend to them that they don't make it obvious that they're your client. Of course, people can always choose to do that if they want to, but that's not the ideal way to interact with you, because you'd prefer they contact you in session to talk about things. Also, you want to let them know that you don't expect them to follow you on social media. You are not expecting that they'll come in and have done homework, like asking you about a TikTok video or Instagram post that you made. And vice versa, you want to let them know that you do not follow or friend or interact with clients on social media in any way. So you will also not be going onto their channels and seeing what type of things they are posting. If they'd like to share that with you, that's very welcome, and they can do that with you in session, but it's not something that you are doing outside of session at all. Okay, 9 is a big one, and that is payment and insurance. I put these 2 together because they are fairly intertwined. So payment, you want to outline exactly how much you charge for a session and when that payment is due. So do you expect people to give you a credit card number and you will charge it at the beginning of each day? Do you charge it after they leave for that session? Let people know so that they know what to expect. And if for some reason you're not accepting credit cards yet, then let them know how else they should pay. Related, for insurance, here's where you really want to outline one of 2 options. Do you contract with insurance, or do you not contract with insurance? So if you do contract with insurance, let them know I contract with the following insurance panels, and I will bill that insurance panel directly, and let them know if they have any type of a copay, how that process goes. If you don't contract with insurance, then you want to outline whether or not you will provide a super bill or a form that they can submit to their insurance company for reimbursement. This is not something you're required to do, but you can do it, and most therapists do this. And regardless of whether or not you're doing a super bill or you're directly contracted with insurance, you want to let people know some of the limits to confidentiality that are specific to insurance in these circumstances. For example, if you submit anything to an insurance company, you will have a diagnosis. So you as the therapist will be providing the insurance company a diagnosis, a mental health diagnosis on that form. That's very important for a lot of people to know and understand. Also, you want to let them know that by allowing their insurance company to pay for their services, they are opening up their therapy records potentially to that insurance company. So there's a little bit more there, but those are the two major things you want to cover with insurance. Again, whether or not you're contracted with an insurance company, if you are offering a super bill, those two things still apply, and it's your job to make sure your clients understand that. All right, number 10 is a court policy. So you want to identify, do you go to court or not? If you say, no, I don't go to court, obviously we all know if you get a subpoena, you still have to answer a subpoena. If you are mandated to go to court, you're still going to be going to court, right? So even if you say no as part of your court policy that I do not go to court, you still want to outline, and if I am subpoenaed or required to go to court, how much you will charge. This is really, really important because I see so many therapists who end up spending hours and hours on court-related matters, whether it's writing something up or copying records or actually talking with attorneys or the client or going to court. It's a lot of your time, and it's a huge amount of stress and energy for most therapists. So please prepare, identify a fee so that you are paid for your time. And no, you cannot make your fee some exorbitant amount like $25,000 for the day when your typical session is $100 an hour just so that you can avoid court. There are different schools of thought on this, but if you want a general rule, then you can go by whatever your hourly rate is. The 11th thing you want to have in your informed consent document is the right to records. So letting your clients know that yes, you take records, yes, you will be writing notes and doing other documentation, and they have the right to access those records. Most clients don't really care either way, kind of anticipate this, or are never going to request their records, but it is really important that you let people know, yes, I do take notes about our sessions, I'm required to do so, and if you ever want to see them or have questions about them, all you have to do is let me know. The 12th thing is your governing body, and you could include this in the same area where you included your scope of practice, but this is where you want to let clients know exactly what body is in charge of you. So for example, for me, it's the Board of Psychology in California, and you want to give people the contact information for that board. 13, you just want to have a quick statement that says something like, yes, I agree to these terms and conditions. There's no need to belabor it or add a huge statement there, but you do want to have something that someone either initials or checks off, or they're going to sign right underneath that statement so it's very clear they're agreeing to that. And then 14 is their signature and the date. And obviously, if you see kids or if you see someone who has a guardian in any way, you want the guardian's signature as well. But it's really important to have those forms signed and dated. Now, after reviewing these 14 things, hopefully you feel really prepared to write your own informed consent document. But if you're not, I've got you covered. You can click below.
Okay, so I think that that is a really good explanation. She does a better job than I could of telling you what should be in informed consent. And so for this week's assignment, you are going to make your own informed consent. Here is mine. So I've had many iterations of an informed consent. This is the one that I wrote when I was in school, like you guys are. And you can see up here what my letters were. So I had a master's of science and school counseling, a certificate of advanced study in mental health, and I was a mental health counselor. Notice there's no L there because I was under my limited permit at that point. So in here is your informed consent. And in your assignments this week, I've given you a template to add your own language in your informed consent. Here's one thing: you want your informed consent to represent you as a human, you as a counselor, you as the way that you speak. So the way that you write in your informed consent, you want it to just represent you as a person. So counseling services, counseling is not easily described in general statements. It varies depending on the personalities of the therapies, blah, blah, blah. So this is where I talk about the benefits and the risks of counseling. Information about your counselor. So this is when I talk about my professional background. As my permit requires, I practiced under the supervision of Maria Alessio, LCSWR, and June Rickley, LMHC. The information you share with me may be discussed with Maria or June for supervised purposes only, but your identity and any identifying characteristics will not be disclosed. Your confidentiality is protected under HIPAA and the ethical standards of the American Counseling Association. So you can just have a statement just like that. Here was my fee for counseling sessions, what happens if you miss a session, what a no-show fee is, how often we, it's typically scheduled every week or every 2 weeks for a 55-minute hour, contacting me. So this is going to be really important for you guys. You want to make sure, you're not, my guess is a lot of you are going to be doing this in addition to your school jobs. Even if you're not a crisis center, right? So you want to make sure that clients know how to contact you and what to do if they can't contact you. So putting it in your informed consent and also putting it on your voicemail is really important. This isn't something I learned until I got into the field. So it's really important when you set up your voicemail for your practice. Hi, you've reached Dr. Hennessy Lustica, licensed mental health counselor. Please leave your name, number, whatever. If this is an emergency, please hang up and call 911. You want to make sure that you have that statement in your voicemail as well, so folks know where to go in case it is an emergency. Please do not use email for urgent situations. Please do not contact me for urgent situations, right? Making sure that your clients have another higher level of care they can go to if there's an emergency. Limits on confidentiality. I took this right from the HIPAA website, but I made it the language a little softer. So I may occasionally find it helpful to consult other health and mental health professionals about a case, making it your language in there. And then the situations where you're legally obligated to take actions, right? So child abuse, lethality, suicidality, homicidality, that kind of stuff. Professional records, how you keep your professional records. In this case, so this talked about, yes, you can have a copy of your records, but I charge a copying fee of 75 cents per page. I never actually charged that, but just knowing that your time is valuable. And if you are in private practice, you are being billed, you're billing folks by the hour. So all of that kind of extra stuff, you want to make sure that you account for in there as well. Minors and parents. I talk about even where parental consent is given, children over age 12 have the right to control access to their treatment records. So making sure that you put that in there. Professional fees and payment, how much it costs, how long the sessions are, how you should be paid, what happens if you don't pay, and then the acknowledgement. Again, this was old. This was when I had my limited permit. So this is 2012, I would say. So in the video, they talk a lot more about social media. So in the assignment that you're going to do, I've added a section on social media as well. All right, so we've talked a lot this week. I've talked a lot at you. I apologize for that. We talked about HIPAA, we talked about client records, we talked about privacy, and we talked about informed consent. For assignments, you just have one discussion question, and then you have 2 assignments. One of them is going to be creating an informed consent template document. This, you'll hand it in this class, and then we'll go back to it as you learn more in your internship. And it's definitely a living document that you're always going to improve on and change depending on where you are in your journey. So if you have any questions, please, please, please reach out. Text is best. And let me know if you need anything. Thank you.